So today we are going to start the new topic, that is the nervous system. So where we'll be covering the central nervous system topics as well as the psychiatry topics. Okay. So complete the neurology. At first we'll go through the neurology, that is the nervous system part, and then we also go with the psychiatry part. Okay. So let's begin with this topic. And as I mentioned that at the beginning itself, even the nervous system, it takes a bit long time because it is also one of the important systems where there will be a lot of classifications, and there will be a lot of medication that you need to remember. Okay. And there are a lot of disorders or the systems that we need to learn in the nervous system. So let's begin with this topic, nervous system. Okay. So what I'm going to do is, at first we'll have a look through the basic anatomy of the brain, okay, and the physiology of the brain, so how it works and so on. And then slowly we will move into the main topics of the nervous system. Like will study about the different disorders which are related to the nervous system: epilepsy, Parkinson, Huntington's disorder, okay, and so on. So we'll slowly go towards the uh, major disorders. Okay. So at first, let's have a look through the brain, its anatomy of the brain. So here in this diagram, you can see that you, sorry. So we can see that the brain has the cerebrum. So this is the cerebral hemisphere, so which is the major portion of the brain. Okay. So that is the cerebral hemisphere. And then the brain, it also has another part, that is the cerebellum. Okay. So the cerebrum, cerebellum, and the other part is the major part is the medulla oblongata, which just continues here along with the spinal cord. Okay, so cerebrum, cerebellum, and medulla oblongata, or we can say it has the midbrain part, which consists of the pons, medulla, and so on. So these are the basic structural parts of the brain. The cerebral hemispheres further we can categorize, or further we can divide as the frontal lobes. So there will be many lobes in the cerebral hemisphere, like the frontal part. So this part is known as the frontal lobe, the bluish color, and the greenish color is the parietal lobe, and the back one, that is the occipital lobe. Okay. So in this way, there will be different lobes in the cerebral hemispheres, which are not much important. But here we need to know what are the main functions of the brain. Okay. So when it comes to the cerebral hemispheres, the cerebral hemispheres are the main part where our thinking capacity, our thinking capability, okay, and our reasoning and learning skills, everything will be controlled by the cerebral hemispheres. Okay. So each and every task will be controlled by the cerebral hemispheres. But is it only by the cerebral hemispheres? No, it is not just by the cerebral hemispheres, but even the other parts of the brain, they also coordinate with the cerebral hemispheres in order to control all our functions. Now we are going to have a look through the basic or the important other parts of the brain, okay? So which are responsible for controlling all the functions of our body. So the first thing is about the cerebellum. So here at this part, you can see the basal part. This is known as the cerebellum. And cerebellum is the part of the brain that mainly responsible for maintaining the gait and balance. So when we are standing, when we are walking, okay, so our body's balance will be maintained mainly due to the coordination with the cerebellum. Cerebellum will coordinate with the other parts of the brain and with all our neurons, and it will make sure that while we are standing, or while we are walking, and while we are trying to balance on when we stand at a high level height, okay, and when we try to balance our balance our body, so cerebellum, it plays a major role. It will helps to balance our body. So that's the main function of the cerebellum. Then here in the brain, you can see this part is known as the thalamus. Okay, so the thalamus is also one of the important part. It plays a role, like it mainly regulates the consciousness, alertness, and attention. So for us to maintain that consciousness and the alertness or attention in our body, so it plays a major role. Thalamus is the part of the brain that helps to maintain this consciousness, alertness, and attention. Then it also plays a role in the memory and helps with higher order thinking. Thalamus, it also helps in memory. Then hypothalamus. So hypothalamus, we are going to study in detail about the hypothalamus in our endocrine system. So, but hypothalamus is the part of the brain that mainly regulates the functions of pituitary gland. So pituitary gland functions will be regulated by the hypothalamus. So which means that hypothalamus will keep on secreting the hormones, and those hormones will stimulate the pituitary gland in order to release the anterior pituitary and the posterior pituitary hormones, mainly the anterior pituitary hormones. Um, the release of the anterior pituitary hormones is mainly regulated by the hypothalamus. Okay. So these are the few important things from this slide. So cerebellum main function is to maintain the balance and the gait when we are walking or when we are standing at a high level height. Okay. So our body balance will be maintained mainly by the cerebellum. Then thalamus, it regulates the consciousness, alertness, and attention, and it also plays a role in memory. And hypothalamus is a part of the brain. It mainly regulates the functions of pituitary gland, anterior pituitary gland. Then moving on to the ventricles of the brain. So the brain, our brain, the human brain, it consists of four ventricles. So these ventricles are nothing but the, or we can also say that they are the hollow cavities. Okay, so these are the cavities. Here you can see the bluish color one. Okay, so these two are known as the lateral ventricles. Okay, so there are two lateral ventricles, okay, and one third ventricle and one fourth ventricle. So total there will be four ventricles in our brain. So two lateral ventricles, third ventricle, and the fourth ventricle. Okay, or in this diagram you can see the bluish color one. So this bluish color one uh, is known as the ventricles, and these ventricles, they also contains the blood vessels and as usual the axons and so on. So what is the main function of this ventricle? So ventricles, it mainly contains the choroid plexus. Okay, so ventricles, they mainly contain the choroid plexus. So choroid plexus are nothing but they are rich in blood vessels. Okay? And the main function of this choroid plexus is to keep on secreting the cerebrospinal fluid. Okay, so our brain, it contains the fluid which is known as the CSF, cerebrospinal fluid, and that cerebrospinal fluid will be secreted mainly by the choroidal plexus. So the final point that we need to learn from this slide is, so which part of the brain will keep on synthesizing or secreting the cerebrospinal fluid? It is the ventricles. The ventricles of the brain will keep on synthesizing or secreting the cerebrospinal fluid. And the main thing, that is the ventricles, they mainly contain choroidal plexus. Choroidal plexus are nothing but they are rich in the blood vessels, and also they are contain the axons and so on. So they keep on secreting the fluid, that is the cerebrospinal fluid. Okay. And cerebrospinal fluid, the main function of the CSF is the main lubricating fluid in the brain, and also it is the fluid through which the nutrition will be supplied to the brain. Okay. So in a similar way, in our eye, we will have the um, like in the eye, aqueous humor will be secreted. Okay. So and this aqueous humor will help to lubricate the eyeballs, as well as they also help to nourish the eyes. In a similar way, the cerebrospinal fluid will also plays a major role in the brain. Okay. So these are the important things that we learned from this slide. Then the next part is about the basal ganglia. So the basal ganglia is responsible for starting and controlling voluntary movements. So all our voluntary movements. So here in this structure, this part, okay, it is the basal ganglia. Okay, so this is the basal ganglia part, and it is mainly responsible for controlling our voluntary movements. Okay? Like if we want to stretch our hand, okay, so voluntarily, if we want to stretch our hand, then it is mainly controlled by the basal ganglia. Okay, and what will be the voluntary activities that we want to do? Everything will be controlled by the basal ganglia. It acts as a gatekeeper, which movements to allow and which to stop. Like how it works is, usually whenever the impulses they reach, whenever the signals they reach to the brain, ultimately the signals they will pass and they will reach to the cerebrum. So this part, the big part, is known as the cerebral hemisphere. So all the impulses or all the signals they will reach to the cerebral hemisphere, and from those impulses, let's say for example, if there are 100 signals they reach to the cerebral hemisphere, what will be the important one which is required for our body? Then basal ganglia will filter all those impulses, all those signals, and it will take only the important signals and it will send to our sensory organs. Okay, so let's say for example, whenever like your hand, if your hand is getting exposed to nearby there is a fire, and if your hand is getting exposed to the fire, then immediately the our sensory receptors on the skin, they will pass the message. So through the efferent arteries they will pass the information, or they will pass the message to the brain. It will reach to the cerebral hemisphere. Then from there, basal ganglia is the main part that will decide. Okay, so it participates in the decision making. So basal ganglia is the main part that it will decide, and immediately it will send the efferent reflexes to the skin, and it will ask our body to remove the hand from that site of fire. Okay, so in this way, basal ganglia, it plays a major role. Like it acts like a gatekeeper, and it helps only to it helps to filter the information, and whatever be the information that is required for our body, it will pass that information to all the other organs. Okay, so that's the main role of the basal ganglia. Okay, which means that basal ganglia, it will participate in decision making. Then the next important topic is the most important one, is about the cranial nerves. So we need to know about like we have studied like even when we were in our school life, like in the board of intermediate, and also in our pharmacy, bachelor of pharmacy level. So we have studied about the cranial nerves. So there will be total 12 pairs of the cranial nerves in our body, and all these 12 pairs of the cranial nerves, they regulate different functions. They play a major roles. And these cranial nerves, they mainly arise from the midbrain part. Okay? And the main function of this cranial nerves is to regulate the functions. Like all these nerves, they help to regulate the functions in our body. So let's have a look through what are the 12 pairs of the cranial nerves and what are the functions of these cranial nerves. So it is quite easy to remember all these 12 cranial nerves, okay? Because most of the cranial nerves, they have the same sort of the function. Okay? So now let's have a look through what are the 12 pairs of the cranial nerves and what are their functions in our body. So the first cranial nerve is olfactory nerve. So olfactory is the first cranial nerve. Okay, so total we will have 12 pairs, in the sense on the right side 12, on the left side 12. Okay, on the right side 12 it will arise, and on the left side 12 nerves it will arise. So that's why we are telling it as the 12 pairs of cranial nerves. So the first one is the olfactory. So the basic uh, thing, olfactory means sense of the smell. Okay? So it is the cranial nerve which sends the impulses from nose to the brain. So whenever we smell something, so that information will be sent to the brain mainly through olfactory nerves. So olfactory is the first cranial nerve, and it is the cranial nerve that is applied to the nose. Okay? And its main function is to send the information from nose to the brain. Then the second cranial nerve is the optic nerve. Optic nerve, it is mainly supplied to the eyes, and its function is to send the information from eye to the brain, whatever the information that we see. Okay? So that information will be sent to the brain mainly by the optic nerve. Okay? So olfactory, optic. Then the third one is the oculomotor. Oculo means ocular means eye. Motor means movement. Okay? So this oculomotor, it facilitates the eye movements, the movements of our eye. So whenever we move our eyeballs, so that movement will be facilitated mainly by the oculomotor. Okay. So optic is for eyes. Okay, optic nerve is supplying to the eye. Oculomotor is also for the eye. Okay. Then the fourth one is the trochlear. Trochlear is the fourth cranial nerve. It also helps in eye movement. Okay, trochlear is the fourth cranial nerve. It also helps for the eye movement. So the first cranial nerve is the olfactory for the smell. That is, it sends the impulses from nose to the brain. And the second one is the optic from impulses from eye to the brain. Then oculomotor is also for the eye, but it is mainly used for the movement of the eyes. And it also sends the impulses from eye to the brain. And trochlear is also helps for the eye movement, and it also sends the impulses from eye to the brain. Then the the fifth one is the trigeminal nerve. Okay? So trigeminal nerve is the nerve that mainly supplies to our maxilla, the upper part, mandible, the lower part of the skull, and to the ophthalmic region. Okay, so here in this diagram, you can have a look. So this is our trigeminal nerve supply. So this trigeminal nerve, it supplies to the maxilla, okay, the upper part, okay, mandible, the lower part of the jaw, and to the ophthalmic region, that is to the eye part. Okay, so trigeminal is the nerve which supplies to the our one side of the face. Okay, that is to the maxilla, mandible, and to the ophthalmic region. And as you guys might have heard about the trigeminal neuralgia, okay, where the herpes zoster virus, which will get reactivated. Okay, so, like whenever we have the chickenpox, and then after a few years or any time in our lifespan, so whenever this herpes zoster virus it gets reactivated, then that reactivated virus it mainly attacks this trigeminal nerves. Okay. So it mainly attacks the trigeminal nerves, and as a result, it leads to cause the severe nerve pain. Okay, it is a severe nerve pain. Okay. And that pain will commonly will tell it as a trigeminal neuralgia. Okay, so it is known as the trigeminal neuralgia. So trigeminal nerve is the nerve that supplies to the maxilla, mandible, and ophthalmic region of the face. Then after trigeminal nerve, trigeminal is the fifth nerve. Then the sixth nerve is abducens. Abducens is the sixth nerve, and it also supplies to the eye. Okay, and it also plays a major role for the eye movement. Okay? So olfactory for the nose, optic for the eye, oculomotor for the eye, trochlear for the eye, then trigeminal nerve to the face, and abducens is the sixth cranial nerve, and abducens is also for the eye. Then the seventh cranial nerve is the facial nerve. So the name itself it indicates that facial. It means that apart from where apart from these parts like the maxilla, mandible, and ophthalmic part where trigeminal nerve is supplying, okay, or where the trigeminal nerve is supplied, the other parts of the face, all the other parts of the face, including the tongue, okay, will be supplied mainly by the facial nerve. Okay, so all the other parts of the face, including the tongue, will be supplied by the facial nerve. Okay. So it innervates the facial muscles while affecting the taste perception as well. Okay. So that's about the facial nerve. So facial nerve is the seventh cranial nerve. So olfactory, optic, oculomotor, trochlear, trigeminal, then abducens, facial. Okay. Facial is the seventh cranial nerve. Then eighth cranial nerve is the vestibulocochlear nerve. Cochlea means inner part of the ear. Okay. So this is the nerve that supplies to our ear, and this is the nerve that is responsible for listening or for the sound. Okay, so eighth cranial nerve. Eighth cranial nerve is the vestibulocochlear nerve, and it is responsible for sound and balance from the ear to brain. Then the ninth cranial nerve is the glossopharyngeal nerve. So glossopharyngeal, it is the one that controls the taste and salivary glands. Okay, so glossopharyngeal is the one that controls the main taste and salivary glands. And the 10th cranial nerve, vagus nerve. Vagus is the largest cranial nerve in our body. Okay, so in the nervous system, the largest cranial nerve is the vagus nerve, and vagus nerve is the main nerve that forms a part of parasympathetic system. So parasympathetic system in the sense the release of acetylcholine. Okay, everything will be regulated by the vagus nerve. So sometimes in the textbooks, in the authors, they mainly mention as the vagus control. Vagus control, instead of mentioning it as the parasympathetic system, straight away they will tell it as the vagus uh, release or the vagus control. Okay, so vagus means it is a part of parasympathetic nervous system, and it is the largest cranial nerve in our body. Okay, then after vagus nerve, the 11th cranial nerve is the spinal accessory nerve. So it innervates the head and neck. The spinal accessory, it mainly supplies to the head and neck. And the last one is the hypoglossal nerve. Hypoglossal nerve, it innervates the muscles of the larynx and pharynx. So in this way, we have got total 12 cranial nerves, 12 pairs of cranial nerves. Okay? And each pair of the cranial nerve, it has its own function. But when you look at the functions of this cranial nerves, okay, so first one is the olfactory, that is for the nose, easy to remember, olfactory nose. Okay, so olfactory senses means already from our school life, we have been studying that olfactory means sense of smell. Okay? So olfactory nerve is the first cranial nerve, and olfactory nerve is responsible for the sense of smell. Then optic is the second cranial nerve. Okay? Optic, the name itself it indicates that optic means we all know that it is related to the eye. Okay? Then oculomotor, oculo means eye. Okay? Oculomotor, again, second cranial nerve is for the eyes. Okay? Oculomotor is for the eye, and then the fourth cranial nerve, trochlear, is also supplied to the eye. Okay, so optic, oculomotor, trochlear, the three nerves are for supplied to the eye. And the fifth cranial nerve, trigeminal. Trigeminal, easy to remember because even we will study in detail about the trigeminal neuralgia as well. So what happens in case of the trigeminal neuralgia, and what is the drug of choice for the management of the trigeminal neuralgia? Okay, so because trigeminal neuralgia is one of the common problems, okay, the patients they will have. So we'll study in detail about this trigeminal neuralgia. So easy to remember, trigeminal nerve is the fifth cranial nerve. Then again, when it comes to the sixth cranial nerve, that is the abducens. Abducens is the smallest cranial nerve in our body. Vagus is the largest cranial nerve in our body. So abducens is the sixth cranial nerve, and this sixth cranial nerve again is supplied to the eye. Okay, so how many nerves are supplied to the eye? Optic is supplied to the eye, oculomotor to the eye, trochlear is to the eye, and abducens to the eye. So four cranial nerves out of 12, four cranial nerves they are supplied to the eye. Okay? Then after abducens, the seventh cranial nerve is the facial nerve. So facial nerve is the seventh one, and it is the nerve that is supplied to the facial muscles as well as to the tongue. Okay? And eighth cranial nerve is the vestibulocochlear nerve. So vestibulocochlear nerve means cochlea means inner part of the ear. So this is the nerve that is supplied to the ear. Okay, and glossopharyngeal. Glossopharyngeal is the ninth cranial nerve, and it controls the taste and salivary glands. And 10th is the vagus. Vagus, 100% everyone must remember about the vagus. Okay? So because all the parasympathetic functions are mainly controlled by the vagus. And 11th is the spinal accessory. It innervates to the head and to the neck. Okay? And 12th is the hypoglossal. It innervates the muscles of the larynx and pharynx. So in this way, we have the 12 cranial nerves. And sometimes in your examination, right away, they will ask you the question that among the following, which drugs will cause damage to the eighth cranial nerve? Among the drugs, which drug will cause damage to the eighth cranial nerve? So eighth cranial nerve, it means that you must know that what is eighth cranial nerve. Okay. So eighth cranial nerve is vestibulocochlear nerve. Cochlear nerve, that is meant by inner ear. So indirectly, the examiner is asking the question that among the following, which drugs will cause the ototoxicity? Okay, so indirectly they are asking that which drug will cause the ototoxicity. So there are certain drugs like aminoglycosides, they lead to cause the ototoxicity, and loop diuretic like furosemide. Okay, so furosemide by itself it won't cause the ototoxicity, but when you combine the furosemide with other drugs like aminoglycosides, then the risk of ototoxicity will be more. Okay, so in this way, sometimes in the examination, straight away they will ask you the question that among the following, which drug will cause damage to the eighth cranial nerve? Okay, or which drug will cause damage to the optic nerve? Okay, ocular damage. Okay, so which drug will lead to cause the damage to the optic nerve? or which drug will cause damage to the vision impairment by causing damage to the optic nerve. So when we study about the all the drugs, when we complete the whole things, okay, then you will understand that, okay, so this is the drug that mainly affects the optic nerve. So this is the drug that mainly affects the vestibulocochlear nerve. Okay, so but now just you need to know about all this, the list of 12 cranial nerves, and to which organs do they supply. Okay, so that's about the cranial nerves. And then this is about trigeminal neuralgia. And when we look at the structure of the spinal cord, so the brain and spinal cord, they both need the gray matter and white matter to function. So what is this gray matter? The gray matter is made up of, um, like in the neurons, there will be dendrites as well as the cell body. Okay, so here we can see the structure of the neuron. Yes, yeah. So here is the structure of the nerve cell, our neuron. Okay, so in the nerve cell, this part. Okay, so this is the main part of the nerve cell, that is the cell body. So why we are telling it as the main part? Because it is the part which contains the nucleus, and it controls the whole nerve cell. Okay, so this is the cell body, and this part, the cell body, it will have a rapid, like it will have the capacity to generate the impulses rapidly. Okay, rapid action potentials will be generated by the cell body. And on this cell body, on the structure of the cell body, you can, if you look at here, so you can see these structures. Okay, so the branch-like structures. So all these branch-like structures, they are known as the dendrites. Okay. So the cell body, it mainly contains the dendrites, which are the known as the branch-like structures. And the cell body, it also contains a long tail that is known as the axon. Okay, so this long tail is known as the axon. Okay. And this axon, it ends with the axon terminals. So all these are the axon terminals. Okay. So the whole thing, the whole structure, will tell it as a nerve cell or the neuron. So now the neuron, it mainly contains the main part, the major part, that is the cell body. Okay. And on the cell body, it mainly contains these small branches that are known as the dendrites. And the cell body will end with a long tail-like structure, and this tail-like structure is known as the axon. And this axon will end up with the axon terminals, or will usually will tell it as the nerve terminals. Okay? So nerve terminals or axon terminals, they both are the same. So dendrites, cell body, axon, and axon terminals. So all these are the parts of the nerve cell. Now, the gray matter. So in our brain, we will have different two different parts. One is known as the gray matter, and the other is known as the white matter. Okay? So the gray matter is mainly made up of, up to here, that is the cell body and the dendrites. So the cell body and dendrites, they all form the gray matter of the brain. Whereas the white matter is mainly the axon. The axon part will make the white matter. So the gray matter is composed of the cell bodies and the neurons, sorry, cell body and the dendrites. Whereas the white matter, it mainly consists of the axons, the axon and the axon terminals. Okay. So now in our spinal cord, like in brain and the spinal cord, they mainly contains both the gray matter and the white matter. Okay, so but when it comes to the spinal cord, so spinal cord, in the spinal cord, the interior is made up of the gray matter. So this is the inner part. Okay? So this is the interior part. So the inner side, it contains the gray matter, and the outer surroundings, it mainly contains the white matter. Okay, so the outer surroundings, it mainly consists of white matter. So what is white matter? White matter is nothing but they are the bundles of axons. Okay, and what is this gray matter? Gray matter is nothing but it is the main. It consists of the neuron, the cell body, dendrites, and also some glial cells. Okay, so in this way, in our brain, it consists of both the gray matter and the white matter. So this is the transverse section of the spinal cord. Okay? But when you look at the brain, when you look at the transverse section of the brain will contain gray matter outside and white matter inside. Okay, it is quite opposite. Okay, so in the brain, gray matter will be outside and the white matter will be inside. But when it comes to the spinal cord, in the spinal cord, gray matter will be inside and the white matter will be outside. So what is gray matter made up of? The gray matter is made up of the cell body and the dendrites part, whereas the white matter is mainly made up of the axon and the axon terminals. Okay, then so this is about the spinal cord and how the structure, roughly around the structure of the spinal cord. Okay. Then the next one is about the eye, the physiology of the eye. So when we look at the structure of the eye, our eye mainly contains the photoreceptor cells. Okay. The photoreceptor cells are the main cells that they receive the light. Okay. And there are two types of the photoreceptor cells. One is one is known as the rods, and the other is known as the cones. So rods and cones are the two different types of the photoreceptor cells. So what is the main function of the rods? So rods are the cells. They're mainly responsible for the night vision. Rods are responsible for the night vision, which means that these rods, whenever we are looking at the night time in the dark light, so at least we are getting some sort of the vision. Okay, so we can see few things in the dark light, and that capacity is mainly due to the presence of the rods. Okay, so due to the presence of the rods, we are able to look something at the dark light, in the dark light. Okay, and these rods, they mainly contain a protein that is known as the rhodopsin. Rods, they mainly contain the protein that is known as the rhodopsin. And for the formation of this rhodopsin, okay, and the formation of this rhodopsin, vitamin A is essential. Okay, vitamin A is essential for the formation of this rhodopsin. And in the absence of vitamin A, or in the deficiency of the vitamin A, we have studied, like uh, from our school life, we have been studying that the deficiency of vitamin A will lead to cause the night blindness. Okay, so the deficiency of the vitamin A will lead to cause the night blindness. So because if vitamin A is deficient, then this rhodopsin won't be synthesized. If rhodopsin is not synthesized, then the rods, they can't work. If the rods can't work, then we can't see any objects in the night time, at night time. So that is whenever the light is dim, then we can't see anything. Okay, in the dark light, we can't see anything. Whereas the eye, it also contains another structure that's known as the cones. Okay, so rods and cones. So these two are the photoreceptor cells. So the cones are responsible for the daylight vision. The cones, they mainly contain a protein that is known as the photopsin. Okay. Rods contain the rhodopsin, and the cones, they mainly contain the photopsin. So rods and cones are the structures which are present in the eye. So whenever we look at some object in the presence of the light, then at first the object or the image, it will focus mainly on the photoreceptor cells, that is on the rods and cones. From there, the message will be conveyed to the bipolar cells. In the middle, you can see here from the photoreceptor cells, the photoreceptor cells will receive the image, and then they will pass to the bipolar cells. And these bipolar cells, they connect it to the, or they convey this image or information to the retinal ganglionic cells. Okay, so these are the important one, the ganglion cells. So these ganglion cells are the main ones. Like finally, the information is going to the ganglionic cells, or finally the information is reaching to the ganglion cells. And these ganglion cells, the main axons of the ganglion cells, they join together and form the optic nerve. So optic nerve is the second cranial nerve. So the ganglionic nerves, they join together and form the optic nerve, that is the second cranial nerve. And this optic nerve will send the information to the brain. Okay, so in this way, what happens like in the vision is, so when we look at something in the daylight, it is the cones, they remain active, and in the night light, during the dark light, it is the rods which remain the active. So how it works is, they receive the information or the image, and they will pass that image to the basal cell. From the basal cell, it will go to the, finally goes to the ganglionic cells. From the ganglionic cells, all the axons of the ganglionic cells, they unite together and form the second cranial nerve, that is the optic nerve. And that optic nerve will send the information to the brain. Okay, so this is the main part that we need to know regarding the physiology of eye. Okay. So what are photoreceptor cells? Rods and cones, they both are the photoreceptor cells. And which cells are mainly responsible to convey the information to the brain? That is the ganglionic cells. Ganglionic cells, the axons, they unite together and form the and they form the second cranial nerve, that is the optic nerve, and finally they convey the information to the brain. So that's about the eye. Then the next important structure or the important thing that we need to know is about the sciatic nerve. Okay, so sciatic nerve, it is the largest nerve in our body. So here you can see this is the sciatic region from there where the nerve it arises, and this sciatic nerve it supplies to our legs. Okay, so it supplies to our lower limbs, and it will run throughout the it will start from the spine, okay, and it will run throughout the lower um, leg, okay, or to the lower limbs, and it mainly present on the back side, not on the front side. It will run through the back side, through the back side of our body, through the back side of our legs, or our lower limbs. They mainly contain the sciatic nerve. Okay. So sciatic nerve is one of the main nerves that supplies to our legs, and you guys might have um, heard about sciatic pain or sciatica. So there is quite common problem. So most of the patients, they will start developing this nerve pain, which is known as the sciatic nerve pain. And this sciatic nerve pain, which originates in the lower back and typically radiates down the leg. So actually, the pain it will start from here. Okay, the pain it will start from the lower back and it will radiate towards the legs. So there is a huge difference between the low back pain and the sciatic pain. So whenever the patient they present to the pharmacy with the complaint of I have the low back pain, then the main question that we will ask to the patients is like, do you have the pain only restricted to the lower back region, or do you have any radiating pain to your limbs, lower limbs? So in case if the patient also says that the pain is radiating to my left limb or to my right limb, right leg or to my left leg, then immediately we need to suspect it as a sciatic nerve pain. Okay, so because only in case of the sciatic nerve pain, the pain will radiate to the legs. But if it is just the lower back pain, the pain will restrict only to this side. But in case of the sciatic pain, the pain will radiate to the lower limb. So that's the important question that we'll ask to the patient. And what is the reason why it leads to cause the sciatic pain or the sciatic nerve pain? So the sciatic pain, it occurs mainly due to the compression of the sciatic nerve. So whenever the sciatic nerve it gets compressed, okay. So when the nerve it gets compressed due to the hernia, formation of the herniation. So here in this diagram, you can see, if you clearly observe here. So here in the disc, the hernia is formed. Okay, so a hernia is formed, that is a bulging-like structure is formed, due to which the nerve, the sciatic nerve, it gets compressed. So whenever the sciatic nerve gets compressed, okay, then or here you can see the bulging due to the bulging of the disc. So the sciatic nerve will get compressed. So whenever the nerve it gets compressed, then we'll tell it as the sciatic pain. It will start developing the severe radiating pain, and that radiating pain is known as the sciatic pain. Then the next thing is about the meninges of the brain. Meninges are nothing but the layers of the brain. So there are three main meninges, or the three main layers of the brain. So the three main layers are the dura mater. Dura mater is the outermost covering. Okay. Then arachnoid membrane, okay, and the pia mater. Pia mater is the innermost layer. So pia mater is the innermost layer, and dura mater is the outermost layer. So this is the skull. Okay, this is the skull bone, and this is the outermost layer, that is the dura mater, and this is the innermost layer, that is the pia mater. And in between the dura mater and pia mater, we also have the arachnoid layer or the arachnoid membrane. So dura mater is the outermost, pia mater is the innermost, and in between the dura mater and pia mater, there is the arachnoid membrane. Then here, the important point that we need to know is what is meant by subarachnoid space. So the subarachnoid space is the space between the arachnoid membrane and the pia mater. So you can see, so this is the arachnoid membrane, okay? The arachnoid membrane, and this is the pia mater. So the space between the arachnoid membrane and the pia mater is known as the subarachnoidal space. Okay? And this subarachnoidal space, it is mainly filled with the fluid. Okay? So our cerebrospinal fluid. Okay? So our cerebrospinal fluid is mainly filled in this subarachnoidal space. Okay? So this is the important point that you need to remember. So the ventricles of the brain, they keep on secreting the CSF, the cerebrospinal fluid, and that cerebrospinal fluid, it is mainly present in the subarachnoidal space. Okay. Dura mater is the outermost layer, pia mater is the innermost layer, and between the dura mater and pia mater, there is the arachnoid membrane, and the space between the arachnoid membrane and the pia mater is known as the subarachnoidal space, and this subarachnoidal space is where the cerebrospinal fluid will be present. Okay, so in this way, there are three layers of the brain. Okay, then the next part is we are going to learn about the neurotransmitters of our brain. Okay, so in our brain, in order to communicate between each neuron, so to communicate between one neuron to another neuron, so it requires certain chemical messengers. Okay, so it requires some chemical substances or the chemical messengers. Okay? So these chemical messengers are nothing but they are known as the neurotransmitters. The chemical messengers that are helped to communicate the neurons is known as the neurotransmitter. And if these chemical messengers are not present, then the neurons, they can't communicate with each other. That is, the information cannot pass from brain to the sensory organs or from the sensory organs to the brain. Okay. So now let's have a look through what are the different types of the chemical messengers or the neurotransmitters which are present in our brain. So our neurotransmitters, in a broad sense, we can categorize them as excitatory neurotransmitter and inhibitory neurotransmitter. Excitatory and inhibitory neurotransmitters. Okay. So what is meant by excitatory neurotransmitter? An excitatory neurotransmitter is the one which will excite the neurons, which will stimulate the neurons. Okay. Whereas an inhibitory neurotransmitter is the neurotransmitter which inhibits the neuron. Okay. So which will further relax the neuron. So now let's have a look through the examples for excitatory transmitters. So glutamate, aspartate, aspartate, okay, and some other substances like acetylcholine, epinephrine, norepinephrine, okay, histamine. So they all are examples for excitatory transmitters. Glutamate, aspartate, then our acetylcholine, noradrenaline, adrenaline, histamine, all are examples for excitatory transmitters, which means that whenever they are released in the brain, they will excite the other neurons. And we also have the inhibitory transmitters. GABA, glycine, these two are the most important one. Okay, GABA, glycine, because the common names that we use for the inhibitory are uh, the common like inhibitory neurotransmitters that we use are the GABA and glycine. And to some extent, serotonin and dopamine, they also have the inhibitory property. But the most important one is the GABA glycine. Okay, and excitatory, the most important one that you must remember is the glutamate, aspartate. Glutamate and aspartate are the two examples for excitatory neurotransmitters. GABA and glycine are the examples for inhibitory neurotransmitters. But what are the other examples for excitatory? Are our adrenaline, noradrenaline, acetylcholine, histamine. They all are the other examples of the excitatory neurotransmitters. Okay, so now moving on to how these neurotransmitters they work and what is like what mechanism that it takes place. Okay, so neurotransmitters of our brain, as I mentioned, that excitatory and inhibitory neurotransmitters. So these neurotransmitters are mainly released from the nerve terminals. Okay, so they are mainly released from the nerve terminals. Now let's have a look through this nerve terminals and synapse and how it works. Okay. So as already I have explained you about the structure of the nerve cell. So it mainly contains the cell body, dendrites, and the axon and axon terminals, or we'll tell it as the nerve terminals. Okay. So this nerve terminal, it mainly consists of the vesicles. So vesicles are the main structures which are present at the nerve terminals. And inside the vesicles, it mainly contains the neurotransmitter. So the neurotransmitter will be stored inside the vesicles of the nerve terminals. So now what happens is, so whenever an action potential, it develops and it reaches to this nerve terminal, then that action potential will stimulate the vesicles to release the neurotransmitter. For example, let's say, for example, if someone if someone uh, tries to if someone tries to prick your skin, okay, then you will get that feeling, that sensation of the pain. Okay. And how you are getting that sensation of pain is, so now the first nerve cell or the first neuron which is present on the skin, the main receptors which are present on the skin, so they will receive that information and they will send that information to the first nerve cell. Okay. So this first neuron, it, an action potential will be generated in the first neuron, and it will transmit the information to the neuron terminal, to the nerve terminal. Okay. And here the vesicles will be present, and it will stimulate the vesicle to release the neurotransmitter. And the released neurotransmitter will bind with the dendrites of the second neuron. So here you can see this is the dendrite of the second neuron, and this junction is known as the synapse. Okay, this junction between the two neurons is known as the synapse, and the space between the two neurons, or the space between the axon terminal and the dendrites of the second neuron, is known as the synaptic cleft. Okay? So this junction is known as the synapse, and this space is known as the synaptic cleft. So the neurotransmitter will be released into the synaptic cleft. So soon after the release, the neurotransmitter will bind to the receptors which are present on the dendrites. Okay. So what is the main function of the dendrites? So the main function of the dendrites is to receive the information, is to receive the neurotransmitter. Okay, so that's the only function of the dendrites. Okay. So the function of the dendrites is to receive the neurotransmitter, or to receive the information. Now, this dendrites, when the neurotransmitter, it binds to the dendrites, okay, and this neurotransmitter will stimulate the second neuron. Okay, so if, like, there will be two types of the neurotransmitter. It can be an excitatory or inhibitory neurotransmitter. If it is an excitatory neurotransmitter, it will further open the sodium channels. It will open the sodium channels, or it will open the calcium channels. As a result, a new action potential will be generated in the second neuron, and that information will be sent to the axon terminal of the second neuron. Okay, and then the second neuron will release the neurotransmitter, and the neurotransmitter will go and bind with the dendrites, the receptors which are present on the dendrites of the third neuron, and the third neuron will get excited. So in this way, all the neurons will keep on getting excited, and they will carry the information, and finally they send the information or the message to the brain. Okay, so this is how the nerve cells, they work in our body. Okay? And the junction between the two neurons or the two nerve cells is known as the synapse. Okay? So this is about the how the neurotransmitters, or how the neurons, they communicate the information between each cell. But now we need to have a look through how the action potential will generate in the nerve cell. Okay? So how the action potential, it will usually it will generate in the nerve cells or in the neurons. Okay?